Seizure disorders. Seizures, also known as epileptic seizures and if recurrent epilepsy, are defined as a sudden alteration in normal brain activity that causes distinct changes in behavior and body function. Seizures are thought to result from disturbances in the cells of the brain that cause them to give off abnormal, recurrent, uncontrolled electrical discharges. Pathophysiology and etiology. Altered physiology. The pathophysiology of seizures is unknown. It is known, however, that the brain has certain metabolic needs for oxygen and glucose. Neurons also have certain permeability gradients and voltage gradients that are affected by changes in the chemical and humoral environment. Second one, factors that change the permeability of the cell population, that is in ischemia and hemorrhage, and iron concentration, sodium and potassium, can produce neurons that are hyperexcitable and demonstrate hypersynchrony, producing an abnormal discharge. Classifications. Seizures are classified by the origin of seizure activity and associated clinical manifestations. Number 1. Anything the brain can do as a normal function, it can do as seizure behavior. Number 2. Simple partial seizures can have motor, somatosensory, psychic and or autonomic symptoms without impairment of consciousness. Number 3. Complex partial seizures have an impairment but not a loss of consciousness with simple partial features. Automatisms or impairment of consciousness only. Number 4. Generalized seizures have a loss of consciousness with convulsive or non-convulsive behaviors. Number 5. Simple partial seizures can progress to complex partial seizures and complex partial seizures can secondarily become generalized. Number 6. Non-epileptogenic behaviors can emulate seizures but have a psychogenic rather than organic origin. Causes. The cause may be unknown or due to the one of the following. First one, trauma to head or brain resulting in scar tissue or cerebral atrophy. Second, tumors. Third, cranial surgery. Fourth, metabolic disorders, hypocalcemia, hypoglycemia or hyperglycemia, hyponatremia and anoxia. Fifth, drug toxicity such as theophylline, lidocaine and penicillin. Sixth, CNS infection. Seventh, circulatory disorders. 8. Drug withdrawal states, alcohol and barbiturates. 9th, congenital neurodegenerative disorders. Clinical manifestations related to area of the brain involved in the seizure activity may range from single abnormal sensations, aberrant motor activity, altered consciousness and personality, to loss of consciousness and convulsive movements. Impaired consciousness, number 1. Number 2, disturbed muscle tone movement. Number 3, disturbances of behavior, mood, sensation or perception. Number 4, disturbances of autonomic functions. Diagnostic evaluation. First one, history taking, obtain history, seizure history, including prodromal signs and symptoms, seizure behavior, post-ictal state, history of status epilepticus, and about aura, circumstances before attack such as visual, auditory, olfactory or tactile stimuli, emotional or psychological disturbances, sleep and hyperventilation. EEG with or without video monitoring locates epileptic focus, spread, intensity and duration, helps to classify seizure type. And MRI CT scan to identify lesion that may cause of seizure. SPECT or PET scan, additional test to identify seizure foci. Neuropsychological studies to evaluate behavioral disturbances. Management, pharmacotherapy, drug selected according to seizure type, biofeedback usual in the patient with reliable auras. Surgery, resective and palliative operations, temporal lobectomy, extratemporal resection, corpus colostomy, callostomy, CALLOSOTOMY, colostomy, hemisprectomy, HEMISPHERECTOMY, hemisprectomy, and vagal nerve stimulation. Complications: status epilepticus, injuries due to falls. Anti-epileptic medications are clonazepam, carbamazepine, ethosuximide, felbamate, phenytoin, and primidone, valproic acid. These are the drug of choice for the pharmacotherapy management. Thank you.